At the point when you hear individuals talk about medical services in America, there's one country that appears to stand out. It's a solitary payer medical services framework, similar to the Medicare as far as plans that a few very much been aware Democrats have been advancing. The framework's informal name is likewise Medicare, truth be told. It has general inclusion. It has somewhat less expensive medication costs than the United States. Furthermore, it likewise has reports of significant delays and vast reams of administrative noise. You've likely speculated which nation we're discussing. Canada's medical care framework is assuming a bigger part in America's political talk, as the 2020 official races heat up. Moderates on the left love highlighting Canada as an even-handed and proficient medical services framework. Moderates then again use Canada for instance, while advance notice about the risks of associated medication and unrestrained administration. So how different truly is Canada's medical care framework based on what's happening in the United States? In 2017, it's assessed that Canada spent around 10.4% of its GDP on medical care. By correlation, the United States is assessed to have spent around 17.2% of its GDP that year. The OECD gauges that Canada spent around $4,500 per individual in 2017. In the United States, however, the figure's expected to be something like twofold that at $10,000 per individual. Cash-based spending is additionally lower in Canada. Overall, Canadians spent around $650 per individual in 2016. The normal for Americans was around $1,100 that year. Canada really does in any case spends more than the normal of each of the 36 OECD nations, which comes in around $3,800 per individual, and 8.8% of GDP regardless of expenditure west than the United States. Canada's Medicare framework guarantees residents have all-inclusive inclusion for clinical necessities that are considered fundamental, something the US has cultivated. Canada additionally has practically identical or preferable well-being results over the US, despite the fact that it spends less cash. However, contrasted with different nations, Canada's medical care framework has space for development. Analysts took a gander at the pace of passings that might have been forestalled with legitimate admittance to mind across 11 nations. Canada positioned 7th on the rundown while America was last. We can see similar patterns in newborn child death rates. Canada beats the US, yet different nations like Sweden and Australia have a lot of lower baby death rates than Canada. Canadians likewise live longer than Americans. Canada's normal future is among the most noteworthy of the multitude of nations and is almost 4 years higher than the US. Also, Canada's maternal death rate is just multiple times lower than that of the United States, and more Americans pass on from coronary illness and stroke than Canadians. So how does Canada figure out how to spend less cash than the United States while having a more compelling medical services framework? Canadian Medicare is a freely supported model with private conveyance. The framework was laid out to guarantee value among residents, no matter what individuals' capacity to pay. It was additionally made to keep authoritative costs low. There no private arrangement can take cognitivism. Thus the family's capacity to pay just an administration can require charges on that premise. All Canadians accepted their well-being inclusion through Medicare, which is run at the nearby level by every area under government watch. So essentially, the well-being service and the capital in Ottawa figures out the thing methods will be covered, what we will pay for it, what pills we will cover on our rundown. These are choices that are made independently by insurance agency, essentially in the United States. That is T.R. Reid, writer of the book, The Recuperating of America. He ventured to the far corners of the planet investigating different medical services frameworks and how well they work. Also, Canada, everyone has the very treatment that it would make them bonkers. Assuming George got preferable medical services over Sam did, that is not satisfactory. You can't. There's some minor departure from what is covered in light of region, however most restoratively fundamental consideration is covered with no cash-based costs. There are a few widespread exemptions. Professionally prescribed drugs are not viewed as fundamental under Medicare. Dental, emotional well-being and optometry are likewise not covered except if they are viewed as restoratively important on the grounds that Medicare doesn't cover everything. Most Canadians likewise purchase private medical coverage through their managers to enhance cash-based costs. They cannot in any case utilize that private protection to buy care that is covered under the public authority plan. Assuming there's any treatment or method or medical procedure that the framework covers under its principles, then you can get it secretly. This is on the grounds that you know how in America, we disdain this idea of associated medication. Anything it implies that is genuinely horrendous. In Canada, the terrible thing is what they call two-level medication, that is, they don't need rich individuals getting better consideration for destitute individuals. That would be awful, that would abuse their fundamental egalitarian and values. In America, we sort of assume that a rich child will seek preferable treatment over an unfortunate child. That is somewhat standard. In Canada, that sounds no-no. That is a basic. In 2015, private financing, for example, family cash-based expenses and private protection spending represented around 30% of medical care spending in Canada. In spite of most of medical care being openly subsidized, most emergency clinics and specialists' workplaces are exclusive and worked. Specialists who own their own private practices are viewed as project workers who construct the Public Authority Protection Reserve for their administrations. The public authority isn't their chief. The specialists are not permitted to rehearse beyond the framework. They can either rehearse totally in the Public Authority Medicare framework or all the way out of it. Furthermore, there are not very many spots in Canada where a specialist can earn enough to pay the rent without taking the Medicare patients. Also, in this way for a great many people, that is the main decision. In spite of having general inclusion, the framework actually has a few issues. Standby times are longer in Canada than the United States. In a 2016 review, 53% of Canadians said they couldn't get an arrangement on the equivalent or following day when they were debilitated, or required consideration. The United States performed somewhat better at 42% out of each of the 11 nations overviewed. Canada played out the most terrible in that classification. 30% of Canadians said they held up 2 months or longer to see an expert, contrasted with 6%. In the United States, almost 1 out of 5 Canadians hung tight 4 months or something else for elective medical procedure. While just 4% of American respondents said something very similar, around 60% of Canadians find it hard to get to clinical consideration in the nights on ends of the week or during occasions, without going to a clinic. These significant delays can prompt the abuse of the trauma center, where a big part of Canadians said they've held up 2 hours or more to be seen. It's a decent framework, yet it doesn't work that well in Canada. Strangely, in its own nation of origin, there are long holding up lines. You know, they're consistent tales about care being denied, or individuals just needed to stand by months just to see the specialist. Also, I accept that is on the grounds that the Canadians are so modest. They simply don't spend enough on medical services to have an energetic framework. A few territories like Saskatchewan, where this began, have more limited sitting tight times for both intense and elective therapy than the majority of the United States. So there are portions of Canada where it works. Not everything clinical consideration is canvassed in Canada, which leads individuals to have critical cash-based costs. Government medical care doesn't group physician-endorsed drugs as fundamental, and that implies they are not covered for some patients. There are a few social projects to assist Canadians with paying for drugs, however the advantages differ by area. For instance, Ontario gives physician-endorsed drug inclusion to anybody under 24 years of age who doesn't have private protection. The area likewise has a medication program for individuals 65 and more. Seasoned Canadian drug costs are additionally not quite as controlled as different nations. The residents are wild about it. They say it's egalitarian and it treats everyone the equivalent. That is the main cultural worth in Canada, is treating everyone similarly. Also, the other thing they like about it is they understand it's superior to the US framework. They have improved results. They have better recuperation rates from infection. They have longer future and they save money. Also, man, they love being superior to the US. That is important to Canadians. If you found this video helpful, make sure to give it a thumb up and share with your friend. Thank you for watching.